Hey guys, it's Dr. D'Anthony here with Adapt Chiropractic Company. With us is one of our favorite patients. This is Melissa. Melissa, you've been a patient for what, about a year now?
Yes.
About a year. When Melissa first came into the office, she was struggling with very severe headaches and migraines and neck pain, discomfort. So I just wanted to give you guys some insight as far as what she was struggling with, as well as how her care has helped those symptoms. So Melissa, when you first came in, how are your headaches? How are your migraines? How are those affecting you on a given day?
Yeah. They had actually turned to chronic, so it was, more days in the month than not. So, and years and years ago, they were more episodic, but then they were chronic when I was actually first started here.
Mm-hmm.
And yeah, very severe and severe neck pain, and just kind of affected my entire body.
Yes. So when you had those symptoms in the years past, what were you doing to help relieve some of those symptoms?
Medication.
Medication, a big one. Had you gone to a chiropractor in the past?
I have.
Yep.
Mm-hmm.
So when you first came into our office, what maybe surprised you was there anything that surprised you that you didn't expect to have done when you first came in?
I liked all the testing. I think that was a big thing.
Mm-hmm.
I liked that there was a lot of questions about just everything that I was doing in my life.
Yes. Now, since coming for your adjustments, what has been the biggest change that you've noticed?
The biggest changes that I've noticed are I have to take my medications way less often. I'm actually probably trending back to episodic migraine instead of chronic.
Yep.
I also take preventative migraine medication, and I'm starting to get off of those, which is a big thing. I used to have to use my neck and shoulder massager for hours on end most days, and now I sometimes don't even think about it for weeks at a time.
Wow.
So yeah, it's been huge.
Awesome. Now, if there's someone maybe out there, maybe a viewer watching that has struggled with a lot of chronic headaches, migraines, neck tension, they've tried everything but chiropractic care, or they maybe have gone to a chiropractor, what would you advise them as far as they do?
I would say do it, but be consistent when you do it, because I think, especially with migraines and headache, we have to be really consistent in everything we do. So I think taking care of yourself in that way is a big thing.
Yeah, it's great.